This is WRAL News at 7 with special coverage of coronavirus. Facts, not fear.
As we head into a holiday weekend, several new guidelines have come down from the state in the ongoing effort to flatten the curve. Good evening and thank you for joining us. I'm Gerald Owens.
And hello, everyone. I'm Deborah Morgan. Another day, new information to share with you right now at 7 here on WRAL. Here is where the numbers stand tonight. North Carolina has just under 3,700 confirmed cases. 398 people are in the hospital. 77 people have died in North Carolina. The governor announced a new executive order today, the latest implementations in an effort to flatten the curve in North Carolina.
It covers three areas: retail, unemployment, and nursing homes. We start with retail and the changes coming to the way we shop. Beginning at 5 p.m. on Monday, stores that are still open may not exceed 20% of the stated fire marshal capacity. They must have markers 6 feet apart to space customers at checkout.
The second part of the order addresses unemployment, recognizing the issue with slow filings and backlogs. The governor says the goal is to make sure claims can be filed faster. One way leaders hope to do that is by giving employers the ability to file mass claims for employees.
And less than 24 hours after identifying several nursing home facilities as outbreak zones, including a hotspot in Orange County where 65 patients and 18 staff members tested positive, there are mandatory guidelines for nursing homes. It includes an end to shared dining spaces, face masks for employees, and monitoring all residents and staff for COVID-19 symptoms. We're going to take an in-depth look at all of these new measures over the next half hour.
David Crabtree will talk with the head of the State Retail Association about the impact this new measure will have on stores. Gerald and I will also speak with economist Mike Walden about the latest numbers and projected recovery.
WR's Lena Tillett takes your concerns about new CDC guidelines to the state's health secretary. There's plenty to discuss, but let's start with the national coronavirus briefing going on right now. Mark Boyle has that from the Live Center. Mark?
Gerald, Dr. Burke still speaking right here behind me, watching what's coming in from Washington, D.C. here in the Live Center tonight. President Donald Trump just wrapped up his statements and walked off. He's continuing negotiations right now with the president of Russia and the king of Saudi Arabia. On your screen, I want to go through some of these bullet points. These are the key talking points the president had earlier this evening. The airline assistance program is going to be rolled out this weekend. So details of that, he's going to have conversations with the heads of all the major airlines this weekend. Oil production negotiations ongoing right now. He was on the phone call, as I mentioned, with those heads of those countries earlier, and that continues right now. And President Trump also saying we're at the top of the hill in terms of the number of cases. So hopefully that holds and those numbers continue to go down. Now, more on the negotiations. We've seen oil prices plummet. That's not a good thing for those who are in the oil industry. Good for us at the pump, of course. Here's the president had to say in terms of the negotiations right now.
There's so much production, nobody even knows what to do with it. That's how it's working. And Saudi Arabia and, as you know, Russia, it's well known that we're producing a lot, and they were perhaps fighting with each other over the production and the amount of oil being produced. And frankly, there's not enough room to even store it.
President Donald Trump also saying that we could expect that oil deal to be finalized. The details of it obviously still being worked out. The deal could be finished by the end of this week. Back to you.
This order requires new social distancing policies at retail stores that are open. This should make shopping safer for customers and retail employees and help prevent stores from becoming flashpoints for virus transmission. Effective Monday at 5 p.m., stores may not have a number of people inside at one time that is more than 20% of the stated fire capacity, or either 5 people for every 1,000 square feet. The stores must also mark 6 feet of distance at places where people need to gather, like at checkout lines, and they must perform frequent environmental cleaning and routine disinfection. Even as we follow the stay-at-home order, there are still essential reasons to leave the house, like for groceries or medicine. And we want to ensure that retail stores are as safe as possible for everyone so that no one is afraid to go out for basic necessities.
That's a big order from the governor meant to stop the spread. As you heard, it takes effect Monday, even though many stores have already made changes. Joining us now to talk about this is the president of the North Carolina Retail Merchants Association, Andy Allen. Andy, thanks for joining us. Before we get your reaction to the governor, quickly tell the viewers about what your association does when things are normal and how that's changed during this pandemic.
Normally, our organization is focused on helping retailers, both large retailers and small retailers throughout the state in all kinds of trade lines, from grocery to pharmacy to home improvement to jewelry, you name it, comply with the laws, understand how to better market their businesses and succeed in the retail marketplace in North Carolina. We also do a number of advocacy outreaches with the North Carolina General Assembly and other agencies of state government.
You know, Andy, no announcement, no executive order is going to make everyone happy. I've had so much pushback from people today concerned about what the governor said. What's your reaction?
Well, we had some very thoughtful conversations with the governor and his staff, and you've seen, as you mentioned, retailers put some of these measures that the governor required today in place already voluntarily, whether that was limiting the number of people in the store or that you've seen in so many stores to try and help customers know how far to stay apart. And I think what we were seeing was you saw South Carolina take a very similar measure, and the governor, as I understand it, wanted to see this rolled out uniformly across the state of North Carolina and see all retailers that are open practice those social distancing policies and sanitation policies, one, to better protect the customer and better protect the employees. And we, as retailers, want to make sure we have the safest environment possible for people to shop when they do have to get out and go get their essential items.
You know, Andy, we live in an instant society. We want answers quickly. We want things solved quickly. I did some research about an hour ago. The first known case of this was 113 days ago, less than 4 months ago. No one could have ever anticipated what we're living in now. So when we ask the question, should more have been done sooner, is that a fair question?
I think it was so much unknown at that time that I don't know that we could have reacted in that way that quickly. And I think we have taken measured steps as we go, both from the government side and from the retailer side. I mean, I don't think you would have ever seen, the thought of retailers limiting people in their stores or putting plexiglass up or putting stanchions outside to encourage people keeping 6 feet apart. I think if we'd have done that from the beginning, we probably would have gotten a lot more pushback. We've talked to retailers who have said, it's been interesting to watch the customers over the last 2 to 3 weeks. Their attitude has changed. They're much more hospitable to each other. They're giving people more space. They're being more polite. They're trying to get in the store and out of the store, whereas 3 weeks ago, that was not necessarily the case. So I think we've had a change in behavior, people recognizing the importance of this issue.
Yeah, that is a great point. In many cases, you do see people really yielding to what we're up against now. One last question, Andy. Do you see any further restrictions or regulations on the horizon?
Well, I think the governor, he laid out the 3 requirements that you mentioned earlier, and then he listed some best practices that I think, depending on the type of retail store that you're in, can also be implemented, whether that's plexiglass at the cash register or one-way aisles or senior hours. It don't fit every single retailer. You don't necessarily need a senior hour in a convenience store, but those are things I think that they're looking that we could do in addition to those requirements to, again, make it safe for the customer and safe for the employee when they're out and about and when they need to go to the store. And again, get in and get out quickly. The last point I would also make is, and the governor mentioned it today, we encourage people, send one person per family if possible to the store to shop. Don't bring your child unless you don't have childcare. We don't want them leaving in the car or at home, but don't bring the whole family, and make the most efficient trip as you can shopping for the betterment and safety of the customer and our employees.
And if you can, shop for your neighbors. You can help somebody leave the groceries at their doorstep. It can work.
Absolutely.
Andy Allen, president of the North Carolina Retail Merchants Association. Thanks for your time. Best to you, Andy.
Thank you very much for having me.
Changes from the CDC give critical care workers the green light to continue working even if they have been exposed.
Is this a responsible decision from the CDC?
Coming up, WRAL's Lena Tillett takes these concerns straight to Dr. Mandy Cohen.
And how soon people filing for unemployment in our state can start seeing their checks. We'll be joined by NC State economist Mike Walden to break down the latest numbers and what they mean for the road to recovery. You're watching WRAL News at 7.
This is WRAL News special coverage. Facts, not fear.
Welcome back to the Live Center right now. I'm Mark Boyle. Some brand new information coming out since our 6 o'clock newscast from Durham County. 10 Durham County residents right here at the top of this line now testing positive for COVID-19, bringing the total in the county up to 245. You see that number right there. Also, Durham County releasing some new information. They've come to an agreement with new funding, $1.6 million to house the homeless population, or at least some of them, at this Marriott property at RTP. According to the website, there are hundreds of rooms here. So again, $1.6 million in county funding to help with the homeless population during the COVID-19 outbreak.
Since March 16th, the Division of Employment Security has accepted 497,000 unemployment claims. So far, the state has sent $40.3 million to North Carolinians, and more is going out every day.
Now, in addition to announcing new guidelines meant to speed up the application process, the state confirmed today that those applicants will see additional money from the federal government. $600 payments from the federal government by April 17th. For self-employed workers and independent contractors, it could be a few more weeks. Both groups will see retroactive payments going back to the beginning of April.
The latest numbers from the Labor Department are stunning, yet not surprising. 6.6 million people filed for unemployment last week, the second largest number of initial unemployment claims in history since the Labor Department started recording these numbers in 1967. Joining us now is NC State University economist Dr. Mike Walden. Thank you so much for joining us, Mike.
My pleasure, Deborah.
Mike, the U.S. has lost 10% of its workforce in 3 weeks. This happened over the course, like I said, 3 weeks, a much quicker pace than we saw during the Great Recession. Now, on a national stage, how do you recover from this, and what timeline is realistic?
Well, I think Deborah hit the nail on the head. She said this is stunning but expected. We are in an economic shutdown that's been mandated in order to control this virus. This is not this kind of recession we had in 2008, which was due to people overborrowing, lenders lowering their risk levels, et cetera. This is a shutdown of a sizable part of the economy in order to control the virus. And we're not done yet. I think that the jobless claims will go up. I think unemployment will go up. I think it's almost a lock now that we're going to have double-digit unemployment rates both in the nation and in the state. But what determines whether we turn the corner here is whether we've turned the corner on the virus. If we get a plateau in new cases, if we see new cases go down, if we see deaths go down, that should allow decision makers, public decision makers, to perhaps consider loosening some of those restrictions and that we move toward at least partially opening the economy. I know that depends on a lot of things like testing, et cetera. When will that happen? I think probably not in earnest. My guess is until sometime in June, July. So I think we're probably in for 3 months of bad economic news. I hope that in the third quarter, July, August, September, we start to level off, and then I think we'll start to have economic growth in the fall. But I'm increasingly of the mind, Gerald, that this is not going to be a sharp rebound. People are still going to come out of this hurt. Businesses are still going to come out of this hurt. People are going to be scared. I think the virus will probably make a return sometime in the fall. That's what previous viruses have done. So we might have to deal with a smaller version of this. So I'm increasingly of the mind that we're probably not going to see the economy get back to any semblance of normalcy, and certainly not at the good levels it was before the virus, until a year, if not more than a year away.
Oh, that's tough news for a lot of people to hear. Mike, at the same time, I was reading an article today on WRAL TechWire, which says a lot of tech companies are still hiring right now. So that's a little bit of positive news.
It is positive, and of course, those folks are tech people, so they've been able to work remotely. I've been able to do that, teach students, do seminars, classes through this technology that we're using now. Unfortunately, people in the entertainment area and the restaurant area and the tourist area, as a lot of other service workers, can't do that. So yes, we are seeing this virus and the measures that have been taken to deal with it not affect everyone equally. If you have tech skills and you're able to continue working from home, you may be going through this rather unscathed. But I think this is why the federal government, I'm really impressed at how fast the federal government and the Federal Reserve has stepped up to provide the funds to try to cushion the blow, because we don't want people or businesses to come out of this permanently damaged, because this is no fault of their own. This is not, again, like a typical recession. So I think I've been impressed by how fast the federal government has come forward. Just today, the Federal Reserve said, we don't have the details, they're going to start looking at setting up a program to also provide low-cost funds to small businesses, also to provide low-cost loans to states and municipalities. That's going to be the next really hurdle. North Carolina is going to be hurt. The revenues are already hurt. City revenues are hurt. So we have to worry about the cities and the state being able to continue their functioning. So, but I am optimistic that our elected officials and the people who are managing the federal government seem to really know what we need, and they are continuing to provide it.
We got a lot to think about. Mike Walden, economist at NC State. Mike, we appreciate your time as always. We all hope this gets back to normal as quickly as humanly possible.
Yes, we want to see normal again. Thanks, Joe and Deborah.
Thanks, Mike. New guidelines from the CDC when it comes to critical care workers. We take your questions and concerns to the state's top health expert coming up. Many of you have reached out to us for clarification on the latest CDC guidelines with critical care workers.
Earlier today, Arlena Tillett asked Dr. Mandy Cohen about these guidelines and what workers should be doing to stay safe.
The CDC has recently changed its guidance to say that critical workers can continue to work even if they've been exposed to COVID-19, as long as they don't have symptoms. Since we're not sure right now about asymptomatic transmission, is this a responsible decision from the CDC?
Well, I appreciate the CDC is working under extraordinarily hard circumstances. We're trying to learn as much as we can about this virus, as are they, and try to make good decisions as we go. We know that there are just some settings where we need certain workers to continue to work. I think that the guidance they gave was to make sure that those workers are protecting themselves from the world, meaning using masks for at least 14 days once they have an exposure. So we appreciate that this is a rapidly evolving situation. We are certainly going to be sharing the latest CDC guidance with folks here in North Carolina. But like all things I keep telling folks over and over, as we learn more, this guidance may change and we may have to do other things. But this is the best information we have at the time. We rely on the CDC to give us good guidance as we go forward. And so we will be sharing that with folks here in North Carolina.
And what do you say to people in North Carolina who might be worried about this guidance and worried about going back to work?
Yes, so look, if you are able to social distance in your work, you're able to work remotely, we 100% encourage that. That is what everyone should be doing. It's why the governor ordered the stay-at-home order to begin with. We want folks to be at home, to be physically apart from each other, to make sure that they're washing their hands, that when they're going out, even to the grocery store, that they are physically distancing themselves from other folks. The CDC also did update guidance over the weekend to encourage wearing of face coverings when someone even goes to the grocery store or to get medicine. I think all of those are important steps to slow the spread of the virus, and that's what we're really focused on.
So all people should wear masks?
So I think it's important to distinguish what we say when we say masks. What the CDC recommended was a face covering, a homemade mask or some sort of cotton-based protection for your face. And again, when those things are being worn, it is really about you protecting yourself from the world. To your point, we were talking about that. We don't know how much of this virus gets spread before someone realizes they have symptoms. So we want folks to be covering their faces as much as possible per the CDC guidance. Again, that's not the same thing as when our healthcare workers are wearing face masks that are appropriate for healthcare settings. But yes, the CDC guidance was about wearing masks. I want to make sure folks use them appropriately. And very, very importantly, do not forget the tried and true washing of your hands. Wash your hands, hand sanitizer, wipe down surfaces. Don't forget to do those things just because you have a face covering on. I worry that people will think, oh, now I have a face covering on, I don't need to remember all those other things, but they are still so important. Washing your hands, staying physically distant when you can, those are still going to be important pieces of this work.
Do you think trying to get people back into society, back working again too quickly can reverse any of the gains that you all have made? Obviously, we've seen the forecast model show much fewer deaths in our state predicted from COVID-19, which is great news. But getting back into society, could that jeopardize that?
Look, I think we should all know that we think that the work we're doing, slowing the spread of the virus by staying physically distant, is working, right? It's working. I know it's hard, but I'm really thankful for everyone who's been doing what they have to this point to slow the spread of the virus. And I think right now we don't know yet how long we will be in this, but we're going to take in all the best information we possibly can. We're trying to look at some modeling data that helps us understand what the future may hold. We're trying to learn lessons from around the world and around the country. We have to talk with our business leaders. So there's a lot of inputs that go into, well, where do we go from here? I think any place that we go from here is going to continue to rely on us thinking about slowing the spread of the virus. And that's going to go back to these tried and true things of washing your hands and wiping down surfaces. Testing is going to continue to be important. It's going to continue for us to be important to isolate people who do get sick and to make sure that they are not spreading the virus. So there are going to be some core components to this that we know will stick with us as we think about, well, what does the future hold and how do we move forward from here?
Well, Dr. Cohen, we certainly know how hard you all have been working, and we thank you so much for that. I appreciate your time this morning.
Thank you so much.
We know many of you want to help your neighbors in need during this crisis. We have a growing list of links, donation needs, and ways to help students while they're out of school. Visit WRAL.com and search Here to Help for ways you can lend a hand. Thank you for watching our 7 o'clock news on WRAL.
Our next newscast is at 10 on Fox 50 and then at 11 on WRAL. We'll see you then. Have a great night, everybody.